Good afternoon, everyone. I'm Peggy Dodson, and we are pleased that you have joined us for this webinar, Beyond Listening, Mental Health Resources for Moving Forward. The webinar is hosted by the BCM and by the BCM team, Just As I Am. This is a Moravian resource for mental and brain health. Team members Judy Johnson, Sue Bennett, and I will facilitate this session. Today, in addition to hearing from community professionals, we are reminding some of you and introducing others to the provincial resource, Just As I Am. Our goal is, and the goal for this mental health, and you can see this on your slide, is to, the goal is to be a mental and brain health resource for all churches of the Moravian Church, Southern Province. Our purpose is to provide education on mental and brain health for congregations and their pastors, working toward issues and needs being addressed openly and comfortably. And we emphasize some words in our purpose that we think are important both in our mission as well as what we're going to be hearing today. If you're a pastor or Christian educator who missed our presentation at the January Moravian Ministries Association meeting, you can request a folder of information using the email that you see on the slide there. And we also invite individuals to send us requests, feedback, and suggestions to the same email address. Several years ago, as a novice, I joined a group of Moravians interested in providing mental health resources for our churches. From working with this team, I truly understand now the compassion, accurate information, and immediacy that must undergird such an effort. And so we are pleased today to be a part of this webinar. Judy will now share with you some provincial resources and our website. Judy?
Yes, hello. My connection with mental and brain health is serving as a volunteer with the Mental Health Association here in Winston-Salem, North Carolina. I have facilitated a support group here for 10 years of people who have schizophrenia or schizoaffective disorder. The participants are on medication and are kind, gentle, and caring. They interact well with each other, and most are very intelligent. This has taught me much about these folks and the difficult lives they lead with the limitations they experience. This is an especially difficult time emotionally for each of us as we experience fear and concern about the COVID-19 virus among us. As our title of our webinar states, we want to give you some tools and connections for reaching beyond just having someone you know listening to your concerns. If you are having difficulty coping at this time, there is help available, and we suggest you consider these resources. Our team is part of the Board of Cooperative Ministries, and our webpage, which is on the screen, Just As I Am, is located under the Ministries tab of the BCM website, moravian.org/BCM. It lists informative documents along with local and national connections to mental health organizations. This webinar also lists resources to contact, and our speakers will offer additional ones as well. We are fortunate to have so many sources of help in our communities. Glad you are joining us today.
Hello, as mentioned before, I'm Sue Bennett. I'm also a part of the Just As I Am mental health team. I come to this team with personal experiences as well as being on our local NAMI Northwest Piedmont board. NAMI is the National Alliance on Mental Illness. Through our experiences, as well as NAMI, I've had the opportunities to work directly with our guest speakers on numerous occasions. One specifically is the crisis intervention training of local officers in Forsyth and Davie County. As you can see from the slide, Meenal Khajuria is the community engagement specialist for Cardinal Innovations here in Forsyth County. Meenal keeps our local people connected with opportunities and services for improving mental health for themselves and their families. Andy Hagler, who is the executive director of the Mental Health Association, works tirelessly for those in our community that don't have the voice to advocate for themselves. It is such a pleasure to have both of these people, whom I respect highly, as part of our panel. Thank you. Mina?
Thank you so much, Sue, and thank you to you all for this invitation to talk with you all. I was so flattered. I've worked with Sue firsthand, and she is so passionate about her work to increase awareness about mental illness and debunk the stigma that persists. And so again, thank you, Sue, and thank you for all the important work that you all are doing in the Moravian Church around this issue. And of course, I have to acknowledge Andy Hagler, who is really a treasure, and Forsyth County is really blessed to have him as a resource. And so I apologize, I was having some technical difficulty, which is why you are just hearing my disembodied voice and not seeing me as well, but I'm still really glad to be here and talk about self-care. And before I do that, I wanted to just talk very quickly about what Cardinal is. And some of you may be familiar with Cardinal if you are in the Triad region of North Carolina, but some of you, even if you are in the Triad region, may not be. And so that's why I always ask, wherever I am, are you familiar with Cardinal? But I think the easiest way to describe what Cardinal does is that we coordinate behavioral health care for the uninsured or people with Medicaid, and that is behavioral health care specifically. And so in that respect, we are very much like an insurance company. And so you can think of Cardinal in that manner. Because our coverage area is in 20 counties in North Carolina, we do cover 850,000 people. And so we are the largest type of plan like this in the country. And for the Triad region, the counties that comprise the Triad are Davie, Stokes, Forsyth, Rockingham, and Davidson. And so that is our visual footprint. I know some people like to have visuals, but those are the 20 counties that we cover. They're kind of a broad array. And you can see the Triad region, and Davidson is actually, it should be in purple, but it's still in light blue. But we do operate a 24/7 line that anyone can call. So if you come across someone in North Carolina, even if you aren't familiar with these 20 counties, and you think that they might need some help with some mental health problems, you can call that 1-800 number, and they will be directed to the appropriate agency if Cardinal is not the right agency. If, for example, they are in another part of the state, we have a sister organization that does what we do in other parts of the state, or they will get them linked up with Cardinal if they are in one of our 20 counties that we cover. And so for us, behavioral health care is comprised of intellectual or developmental disabilities, mental health illnesses, and then substance use disorders. And so we just saw the visual footprint that we have that shows you again kind of our reach across the state. And so I wanted to touch on that. If you have any questions, please let me know. And there is a PDF that I shared of the organizations across the state that do what Cardinal does and what counties they cover and what their contact information is as well. So that can be shared with you at another time whenever you have a moment to access it. But that also reiterates what those counties are. But let me know if you have any questions and I'll be happy to answer those. But when I was told we were going to be talking about self-care, I smiled because in the behavioral health field, that is something that we talk to each other about a lot. And so when we are in the community, or even when we're checking in on our colleagues, we always say, well, what are you doing for self-care? And what are you doing to look after yourself? And a lot of times, unfortunately, even though it's something that I think we all recognize as being extremely important, it's easier said than done. It's one of those things. There's always so many reasons why self-care kind of for ourselves individually can get put last. And so that's why I titled this, What's That Got to Do with Me? Because self-care is great for everyone, but we often find that if push comes to shove, we've got other things to do that are far more pressing. And that self-care kind of, like I said, goes out the window. And so, of course, there's always a definition of self-care. And I try not to read the PowerPoint slides to people. I find that they don't necessarily like for someone to read the slide to them. But if you disagree, please let me know. What I wanted to really emphasize for you is that in 2017, the Oxford Dictionary actually added it to its pages. So self-care was considered such an important concept that it is now part of the English language. And so we all have heard about self-care, and I think we're kind of familiar with how there are lots of benefits to engaging in self-care. And of course, things that come to mind immediately are being less stressed out, being more positive, but it also has cognitive benefits. So it can help clear your thinking, you're more productive, better relationships. And studies even show that there's a link between people practicing self-care more frequently and leading longer lives. So with all that said, self-care sounds wonderful. It's excellent. It sounds like a phenomenal idea. So why aren't more of us actually doing it? I found this interesting, and I have to admit that I'm guilty of some of this myself. A lot of people think that self-care is for people with a lot of money, or it is for people who happen to have oodles of time on their hands. That's not many of us, actually. So I don't know many people who are thinking, well, I have a lot of resources and I have plenty of time on my hands. I think most of us would say that we're all very busy. We're all trying to be mindful of our expenses, particularly now during this very stressful time where a lot of people are also experiencing financial hardship. But a poll showed that these are the perceptions about self-care. And then there's also this belief, if you look at the different ads we see on the news, such as diets and exercise regimens and losing weight aids and things like that, they kind of help get that viewpoint across that once I lose weight or once I do X, Y, Z, I will somehow be better than what I was, and I'll then be worthy of my own attention. And they kind of push that viewpoint across very subtly. And so that's not what self-care is. Self-care is not about fixing anything because there's nothing wrong with anyone. And self-care is really about caring for yourself in the moment where you are. It's not about having to think about, oh, if I go to the gym today, then you know what, I am worthy of giving myself a little break and not being so mean-spirited to myself. I am worthy of taking my shoes off and just kind of relaxing on the couch. But that's not, again, what self-care is, because there's nothing necessarily wrong with people that and there's nothing that needs fixing. And so all of those different factors combine, I think, to prevent us from engaging in self-care. And so I wanted to talk about some ways that we could actually fit self-care in. And I know that many of us have probably heard about different ways to do these things, but I really wanted to try and find some things that were feasible. And in my notes, I really liked when I was reading about movement, right? Because I am a couch potato, and I am not the kind of person who loves to go to a gym and sweat out endorphins or go for a run. And the thought of doing that makes me just want to lay on the couch and not move at all. But it turns out any movement is beneficial. So it doesn't have to be cardio. It doesn't have to be intense, burn, we're going to tighten up our glutes or anything like that. It can be even for a short period of time. And anything that really gets you moving, that's it, just gets you up and about. So some simple ways you can do this are parking a little further away. If you go to grab groceries and walking a little further in. For those of you who will do meetings, I don't know if you've ever tried a walking meeting. I tried it once, and I thought at first it was a little unusual, but I kind of got into it. But going for a walk, that might be a little challenging now with the social distancing, but if you social distance, you can still kind of walk together. It can even be something, and I enjoy this a lot, just dancing around your home in your socks. It doesn't have to be anything super advanced. It doesn't have to be anything that involves a gym instructor or a gym membership. Just simple little things. Think about things that you enjoy doing, and think about things that you can kind of fit this simple movement into your schedule and make that work for you. The second piece, and there's really no getting around this, is eating healthfully. And eating healthfully can look a little different for all of us. Some of us have different dietary constraints. Some of us are watching our sugar, or some people don't eat gluten. Some people don't eat dairy, things like that. As much as you can, let's say, try to avoid very sugary drinks and lots of processed refined sugar and flour. Those tend to give us spikes of insulin, and then we have that crash where we feel even worse. And as much as possible, just eat some colorful fruits and vegetables, drink some water. I prefer to think of it like that instead of starting to say, okay, well, make sure you get X amount of fruits, and they all have to be washed, triple washed, and double bagged, and dried in the Tuscan sun or anything like that. I think it's just a little simpler to say, in as much as possible, moderation, of course. Try to avoid sugar, processed sugar and flour, eat whole grains, and eat some colorful veggies when possible. I think that's just the best way to say that, because telling people, again, to just cut out all of these things and never have a piece of cake again is not feasible either. And self-care, and this topic of self-care, not only is self-care important, but actually being able to practice self-care is important. And so saying you can't ever have a candy bar again is just not going to cut it. I know for me, I would not be able to follow through on that. So making it feasible and workable for you. Some other things you can do are taking care of your mind and being thoughtful about caring for your mind. Next slide, please. There you go. Thank you. And so whatever our jobs are, whatever our roles are, whether we are caregivers, whether we are loved ones of someone with a mental illness, whether we are working professionally, whether we are caring for people in the home, which is a role in and of itself, we all have various stressors going on in our life. And if there were a way we could avoid them, I wish I knew and I would tell you, but there just isn't a way to do that. So the only things that we can try and do are take steps to, just as we want to look after our body, to look after our spirit. And so we all have these usual suspects of meditation and yoga. I know that's what comes to mind for many people, and some people swear by those things and they love them. Some people, they would rather go get a shot than have to sit still and stare at the woods in front of them. It's just not something that's feasible. And remember, self-care is about what works for you. So what is soothing to your spirit? It could be reading, it could be listening to a podcast or an audiobook even. It could be baking. Remember, that's why I said we're not getting rid of all baked goods, because that is just not doable. It could be knitting. It could be going for a walk, stretching. It could be cuddling with your animals. I know for me, my dog is a big source of joy, and whenever I hold him, I always feel myself calm down just even a little bit. Finding out what these things are that work for you and that are soothing to your spirit are very important. And taking some deep breaths while you're doing these things, allowing yourself to really truly be and to breathe, that's golden. And then sleep and sleep well. Oh my goodness, I saw this and I said 8 hours. Wow, that sounds glorious. Again, these are things that I think are tips to aspire to, but not everyone gets 8 hours of sleep, and not everyone needs 8 hours of sleep. There are those very rare souls that function really well on less sleep, but generally the rule of thumb is 7 to 8 hours. But that can be hard for us. We have, like we just talked about, all these stressors in our lives and all these things demanding our attention. But you know what? I know for me at night, a lot of times I can't go to bed unless I start to clean up and unload the dishwasher and load the dishwasher and fold the laundry, and then it turns into wiping the wood down and all this stuff. And you know, that laundry will still be there in the morning, and I can definitely unload the dishwasher tomorrow. So it's about putting yourself first and saying, you know what, I deserve to get some rest, and I deserve to get some peace, and I deserve to do that now. It's not about after I clean the home that I'll somehow be more or less worthy of rest. No, you are worthy of a great night's sleep right now as you are, even if your home is not the tidiest. And develop your own routine. And this is very, very different based on the individual, but so is self-care. That's what we've kind of been underscoring. It could be that you like to read a few pages of a book before you go to bed. It could be you like to read a religious verse, stretching, taking a warm bath, drinking something warm, whatever works for you that helps kind of get you in the mood to start winding down and helping you start to relax. If you do use your cell phone as your alarm, make sure that eventually it dims. After a while, cell phones tend to go to sleep, so it won't be very bright. But don't have your laptop in the room with you. That type of blue light, lots of light in the room can really prevent you from falling into your sleep cycle. And try to avoid alcohol and caffeine, I'd say at least 3 to 4 hours before a minimum of when you plan to go to sleep, because those have been proven to interrupt your ability to nod off. And so I know Andy will talk about this in great detail, but there should be some, conversation, and that's why I'm so glad he's going to be talking about the different resources and how to define when you might need some additional assistance. But reaching out for help is the most important type of self-care that one can do. And so in North Carolina, you can press **ask from your cell phone, and that will connect you to a crisis line. And so it's 24/7. It will actually link over, if you're in our 20 counties that Cardinal serves, it will link over to Cardinal's access line, and that's staffed by clinicians 24/7, 365 days a year, and they can connect you with care. If need be, they can dispatch mobile crisis, which is a resource where clinicians will come and assess someone in person within a 2-hour window, or they can try and link the person up with getting an assessment or provide them with some resources for seeking some behavioral health care soon if that's what's needed. And Andy, I'm sure we'll touch on that, more of that, but just so you know, **ask. So that's **275, and that is in our 20 counties in North Carolina. And then something interesting that the state developed and unveiled about last week was something called the Hope for Healers Helpline. And so that is really targeted to provide mental health and support to our first responders, our emergency medical staff, and healthcare professionals, as well as their families, who are really experiencing greater amounts of stress during COVID. And so they can call that 919 number, and someone will be able to assist them with linking them with some support as well. And so I just want to again emphasize that this is the one of, if not the most important types of self-care that one can have, is to reach out for help if you need it. And there's nothing wrong with that. And I encourage you to note these numbers down and utilize them and share them with others as well. And I know that we had alluded to some resources, but there are some resources in your resource tab, I believe, that are about mindfulness for adults and ways to practice mindfulness, as well as some easy tips to practice mindfulness for children. There are those things. Just some last reminders, things I want you to remember. When we burn our candle at both ends, we don't end up casting very much of a light. And so many of us are caregivers for people in our lives, our communities, our volunteer efforts, and those things all go by the wayside if we are not okay. And that's why when you are on a flight, you hear a speech at the beginning about how if you are traveling with children, you have to put the mask on yourself first, the oxygen mask, in order to then be able to help anyone else and to help your children. And that's because if we're not looking after ourselves, we can't care for other people appropriately. And so the detrimental effects of not looking after ourselves are just too great. And we deserve to feel good, and we deserve to be happy and healthy. And I think that's the nice thing about self-care is that it isn't just for people with a lot of money, and it isn't just for people with lots of time and maids and housekeepers. It can be done anywhere. And so I can't think of a better time than now to practice it with what we're going on, with what everyone is experiencing right now with the coronavirus. So I would just encourage you to remember that there are resources available. And the last resource that I'll reference that is available to you are some links for you to be able to follow along with some exercises, some yoga, also some links to entertain, just some simple things to help bring a little bit of joy into your life. There are a few links on there for children as well, but please check them out whenever you have a moment. Again, they are just meant to bring a little bit of lightheartedness and joy into what's a very stressful time and help you practice your self-care. And so the last thing I will leave you with is that you are incredibly important. You matter, you are very significant, and your emotional well-being is just as important as how you feel physically. And so I just wanted you to know that. And thank you so much for letting me talk with you about self-care. I hope this was helpful.
Good afternoon, everybody. And my name is Andy Hagler. I am the Executive Director of the Mental Health Association in Forsyth County, which is based here in Winston-Salem, North Carolina. And it's always a pleasure working with the team, with Judy and Peggy and Sue and Nina and everybody involved. And I really want to praise the Moravian province for all that they're doing to bring mental health into the limelight, because as Nina had said earlier, education is key to debunking the stigma associated with mental illness. And I'm sure that a lot of you, whether you're pastors or in your congregations or just with people, since the COVID-19 pandemic, a lot of people have been feeling signs of stress, worry, and a lot of mixed feelings. And it's kind of like now that we've been 5, 6, 7 weeks out, we're now kind of hitting the hard part, as I term it, for shelter in place, wherever you are. And that we have to continue with the social distancing, continue with shelter in place, and continue with this. And while this is very good and very much needed, a lot of times what we're doing can also exacerbate those who live with serious mental illnesses. And it can also cause what I call adjustment issues, or really what I call grief, and maybe what I call anticipatory grief. Because I think a lot of us, myself and all of us, a lot of people included, including members of your parish, your church, are probably having a lot of anticipatory grief, uncertainty about the unknown. What's going to happen if the virus reoccurs? What's going to happen to us? What's going to happen with the economy? And we're really into a lot of the unknowns. And for all of us, and it is okay, is that it's going to cause some pain. It's going to cause a lot of discomfort. And really, we now run our support groups at the Mental Health Association online and through video. And a lot of times what I tell our support group participants is what we're all going through is grief. And if you really think about it, about the losses, whether it's loss of income or maybe people losing jobs or being furloughed, but just loss of being able to get in your car and do the things that you want to do. What we're going through is grief. And some of it may also be termed as like anticipatory grief, because we just don't know what the future is holding for us and what's there. And as human beings, when we are making major changes and when we really don't know or don't know what's going to happen, I think as human beings there is an inherent fear and anxiety about that. So one of the things that I just try to tell people is that what we're going through and a lot of the feelings that we're all experiencing is normal. These are normal reactions to change. And these are very big and very profound changes that all of us are going through. But please keep in mind that for individuals, especially those who live with severe mental illness, severe depression, schizophrenia, bipolar disorder, and so forth, that these profound changes are taking a very big toll, and one of them is the isolation. And I hear that a lot. Isolation, or those not being able to physically see their children and to live their life. So please keep that in mind. One of the things that I wanted to discuss about, and I will have this for you later, and that can be broadcast, but sometimes I get asked, what are the differences between someone experiencing the blues and someone who really has depressive issues? Typically speaking, someone or individuals who have the blues, that's typically a normal reaction to a circumstance in life. Most notably can be the death of a spouse, the death of a loved one, a loss. Obviously, with what we're going through, this is very much a change to our day-to-day routine. But for individuals who have depression, depression is an illness. So it's more than just a reaction to life circumstances. And by it being an illness, one of the causes is that it's usually associated with a chemical imbalance in the brain. So it's physical, medical, whereas the blues is just a normal circumstance. People who have the blues, or if you just even want to say in a funk or just not quite themselves, a lot of times it's only their moods are affected. So there's going to be anxiety, there's going to be feelings of sadness, there's going to be fear of the unknown, but it's usually just our mood. But individuals who live with depression, not only is it going to affect their mood, but it's usually also going to affect their thoughts and their bodily functions. So for example, individuals who live with depression not only are going to experience sadness, loss, anxiety, and even like irritability, but oftentimes people who live with depression also have symptoms such as sleeping too much or not sleeping enough, inappropriate guilt. So for example, it could be that, feeling guilty over something that they have absolutely no control in feeling guilty over. Again, weight gain and weight loss. So again, people overeating, or again, maybe people not eating enough. And oftentimes, people with depression also will have headaches or stomach aches or other bodily aches and pains where there's no quote unquote kind of medical reason for it. So depression affects not only the mood and your feelings, but it also affects your body. Oftentimes, individuals who have the blues, it's usually temporary. Just like we know that with the COVID-19 pandemic, we know in the back of our head this is going to pass. We know that life is not going to go back to normal. There's not going to be the light switch, but we know that this is going to be temporary and whatever our new normal is going to be. But for individuals who live with depression and live with major depression, the moods and the feelings and what they're going through, it persists. And especially for individuals who live with severe depression, it tends to be lifelong. So again, a change in a situation or a change in a living situation, it's not going to change. And again, it persists. Typically, people who have the blues, grief, or again, like I said, are kind of in a funk, typically there's no thoughts of death or suicide. Whereas people who live with severe depression or clinical depression, one of the symptoms is going to be recurring thoughts of death and even thoughts of suicide and even maybe attempts to suicide. And then finally, persons who have the blues or what we're going through, typically their treatment requires a good, warm, empathic listener. So that can be a supportive friend, a supportive family member, a pastor, or if they do need to see a therapist, it's usually short-term counseling, such as like a grief therapist or someone who deals with grief. And along with that, and short-term, it's usually time that individuals who have the blues, going through grief issues, going through adjustment issues, what we're going through, usually they need time to heal. Whereas people who live with clinical depression or very severe depression, they're going to require typically much more. They're going to need medication, medication management, therapy, and then other services that they may need. So it's going to be much more complex. So again, people who live with the blues or grief or whatever, it's usually short term. It's a normal circumstance to what they are going through. It's temporary. And typically what they need for support is a supportive listener, someone who is empathic, and maybe at the most, just some short-term counseling. Where persons who live with severe depression, this is an illness, and depression tends to affect 1 in 4 women and 1 in 10 men. And not only does it affect your mood, but again, it affects your bodily functions, and everything is with your body is affected, and it persists. And it can be lifelong. And where people who live with clinical depression, there are those thoughts of death, and sadly can also be those thoughts of suicide. And again, their treatment is going to be much more complex, where they're going to need medication as well as therapy and other services. Accessing mental health services, oftentimes, and I like what Nina presented earlier, but accessing mental health services depends on what resources you have or what resources that you don't have. So like what Nina presented and gave a little bit of information about Cardinal Innovations Healthcare, and even for those of you from New Jersey, Ohio, Wisconsin, that I saw who are here, usually your publicly funded mental health centers or local management entities, or I know in Virginia they're called community service boards, so how they're termed. Those are usually the access points for those who are uninsured, or for those who have Medicaid. And of course, Medicaid is insurance provider for those who are indigent, as well as for those who are disabled. And for those of you that are out of state or even in Raleigh and in the area, I'm going to put together, and it's going to get dispersed later, access points and resources for those who need the publicly funded mental health services. For individuals who have private health insurance, and this is good for you to note about your parishioners, such as Blue Cross Blue Shield, such as United Healthcare, such as MedCost or Signum, or whatever that might be, TRICARE, which is for veterans. Those individuals who have private health insurance, it's usually just as simple as looking on the back of your insurance card. Typically, in most cases, on the back of your insurance card, there is going to be a separate toll-free number to access mental health services. So again, look on the back of your insurance card. If for some reason you don't see that number, a separate number for mental health services, what I always recommend is either you call the customer services number with your private health insurance, the customer services number, or go on the website of your insurance and again check to see if mental health services is available. So that's really kind of the access point for private health insurance. Now, the other type of insurance is called Medicare. And Medicare and Medicaid are two very different types of insurance. And again, for your publicly funded that have Medicaid, they're usually going to go to your public mental health center. For those who have Medicare as their primary, which can be, of course, for older adults age 65 and older, or for those who have what's called Social Security disability, access point for that can be calling the Medicare number. And the Medicare number to access services is 1-800-633-4227. Again, that's 1-800-663-4227. Or you can go on the website, which is called Medicare.gov. Again, Medicare.gov. And the website there is very easy to navigate, and where you can look for and type in keywords such as therapist, psychiatrist, mental health, and they can actually link you to providers in your specific area who, number one, accept Medicare, and number two, are accepting new patients. So again, ways for Medicare. Now, in North Carolina, and I think in probably most of your 50 states, we also have a resource called North Carolina Health Choice. Again, North Carolina Health Choice. And most states have something like this. North Carolina Health Choice is insurance for children. And that's for children whose parents are low income, but they make too much money to qualify for Medicaid. That makes sense. Again, North Carolina Health Choice and all 50 states have something like this. Again, where parents, they make too much to qualify for Medicaid, but they don't earn enough money to really pay the premiums for private health insurance. And in North Carolina, the toll-free number, which is 1-800-367-6143. Again, that's 1-800-367-6143. And for those of you that I know that are from New Jersey, Ohio, Wisconsin, outside of North Carolina, I can look up and get that information for you. One other way to help, and this is a wonderful website, but it's called Psychology Today. And it's the Psychology Today website, which is very simple. It's called, the website address is psychologytoday.com. And once you get on the home page for psychologytoday.com, you can type in your zip code for the city and state where you live. You can widen the miles, and I always like to at least widen it 7 to 10 miles out. And then on the left-hand side, very user-friendly, there are, on the page, you can use the tabs to help you narrow down your search, such as insurance, such as issues. So again, issues such as anxiety, depression, bipolar disorder, personality disorder, age, because does this provider treat children? Does this provider treat adolescents? Does this provider treat older adults? And then again, treatment orientation. So again, the therapy can be cognitive behavioral therapy, or what's called EMDR, which is eye movement sensitization and reprocessing. It's okay. I won't get too technical, but again, the tabs on the left-hand side can really help you narrow down. Do you prefer seeing a male therapist, or do you prefer a female therapist, or does it matter? So that's a very good resource, Psychology Today, to really help assist you in finding a therapist. Now, and it will also talk about insurance, and the Psychology Today will also cover those who take sliding scale fee. And finally, the last that I wanted to talk about is for those who are veterans. And so for veterans benefits, the toll-free number is 1-877-222-8387. Again, for veteran services, 1-877-222-8387. So again, those are ways and avenues that people can access mental health services. I want to thank you very much for this opportunity to present. I hope that this has been very helpful for you. And again, I will be glad to follow up now and down the road with any help information that I can be of service. And again, thank you very much.
Are we live?
Yeah, Sue, I'm not hearing you.
Okay, I wasn't sure. Peggy started to talk, so I wasn't sure if I was supposed to or not. Thank you all so much for being our panelists for the day. We appreciate all your valuable information. This is a time for questions. If anyone has questions, if you will please put them in the chat and we can send them to the person that needs to respond. As has been mentioned earlier, we do have numerous types of information on our website that can help people if they want to see it. Ruth has added that back up, and if there aren't any questions, I guess this is about it.
And I wanted to make a couple of comments, if it's okay.
Absolutely.
Because this is church related, we have on our website church and mental health items that will really be important for everyone. Wanted to mention that we, as you may notice, we are the mental and brain health, and we purposely added the word brain because we are talking about diagnosable disorders, as well as Andy and Meenal have said, anxiety and grief, which are very real in people's lives. So wanted to make certain that you notice that because it is there for a specific reason. And the other thing I wanted to say is that Christ has, and I use the word present tense, a deep compassion for those afflicted with mental or emotional distress. And you remember Christ healing and curing of illnesses or disorders of that day. And today we are Christ's feet, but we're also Christ's heart, offering a healing presence to those needing care and support, and perhaps a referral. And I appreciate the self-care, and I appreciate what our professionals have given to us as resources, but we all need to be prepared. And my time with on this group has helped me so much to understand that we do need to know what our resources are. And we need to be prepared, and we don't need to be afraid to be a listener. And some of those resources, like the mobile crisis number, Andy, can you speak to that just a second, just so that people know that there are, if you have concerns, there is help available immediately.
Yes, and for those of you that are in the Triad area here in North Carolina, we are fortunate that we have a 24/7 mobile crisis services. And again, and it's for anyone experiencing a mental health crisis. That 24/7 number is 1-866-275-9552. Again, 1-866-275-9552. And that would cover the counties within the Triad. And I think we have an individual from Mount Airy. And I know that Daymark Recovery Services operates in Mount Airy, so that would also apply to that participant from that area.
You know, there are wonderful verses in the Bible that are appropriate this time. Peace I leave with you, my peace I give you. I do not give to you as the world gives. Do not your hearts be troubled, and do not be afraid. And I think fear has been mentioned a number of times. So there's certainly some wonderful wisdom that we can pull from our scripture.
Thank you, Peggy. And I want to mention too, one quick little comment. If you want to save what you have seen in the Zoom chat today, if you look to the right, of the to box down at the bottom of your chat, there's a little 3-dot box. If you hit the 3-dot box, you can click Save Chat, and it will actually save everything that appears in the chat box as a little text file on your computer. So I just wanted to let you know that if you wanted to save some of those resources or things that were mentioned. And we will be emailing everybody the recording once it is available, along with the links to the web pages. Are you guys done? Anything else, Peggy, that you want to say?
No, I just want particularly the pastors and those in churches to know that we are available, and we're happy to come to you all, but we also want you all to come to us with some ideas and thoughts that you may need, so that this is, we all feel good about being this resource. Thank you.